For the past 2 years, UNLV Associate Professor Edwin O. and his students have been carefully collecting
Just try not to splash yourself.
And analyzing the sewage of Southern Nevadans. Professor O is also the head of UNLV's Neurogenetics and Precision Medicine Lab.
The reason why wastewater surveillance works so well is that all of us have to use the bathroom. And when we use that bathroom, any viral pathogen that gets through our GI tract will end up in fecal matter. And that fecal matter is flowing right through under our feet. And as a result, we can get a representation of a community.
And rural areas are represented too, thanks to the efforts of Dwayne Moser, Associate Research Professor at Desert Research Institute, who uses this portable pump.
Like I always say to my people, you don't want to know where this has been.
To extract wastewater from 10 different systems.
I'm doing it because I believe it's important.
In rural Clark and Nye counties.
Especially with COVID, you get these viruses or variants of the viruses coming in from other places. They arrive in the cities first, then gradually move out to these rural areas. So typically we'll see a 10-day to maybe 2-week delay from where Ed first detects it in town here basically to when I start picking it up out in the rurals. So it's keeping us busy. We're sampling these on a weekly basis, and we've been able to actually observe these different variants or subvariants rolling through in time. So we're still picking up, we're still getting hits out in the rural areas, which I think is really interesting. That we sort of think the pandemic is sort of winding down, really. But in fact, the wastewater surveillance isn't showing that. Wastewater, it doesn't lie, it doesn't care. It samples the population that's contributing to it, and you've got a signal.
Workers inside this lab at UNLV are who detect that signal, which Professor O says can show up in someone's stool even before that person shows symptoms of COVID.
That's the power of wastewater surveillance. We're able to have a snapshot of a community when they're potentially pre-symptomatic, when they're asymptomatic, or when they're symptomatic. And so you don't need to have individuals heading in to get tested in order to know whether the virus is circulating in a community.
Professor O provides the Southern Nevada Health District with weekly updates on viral concentration levels, which can also be seen via this interactive map at empower.unlv.edu.
I'm kind of surprised how many people, I'm pleasantly surprised how many people have accessed this website. We've had folks from Russia, from Korea, from Kenya.
The map is just one unique aspect of this wastewater surveillance project, said to be one of the largest of its kind in the United States.
And over the last 2 years, we've learned a lot. We've been tricked a lot by this virus, and I think we're ready as we move forward that if there is a surge in viral material in the sewage, we'll know how to set up testing sites. We'll know how to deploy vending machines with various testing equipment so that folks can have access to some of these resources. So I think that's really a key intervention here. So being able to link that wastewater result back to the public health folks and deploying these resources. I think that's when a program like this makes a lot of sense.